Surgery. Wow, this is a big question because really there are only two ways to cure Morton's neuroma, to surgically remove it or to actually do the ultrasound guided ablations that we do here. Surgery has a 35 to 40% failure rate. That's a documented, data-driven piece of information. 35 to 40% of people have no resolution of their pain after they get out of that boot and after they've had the surgery done. And some people have temporary relief, like for weeks or months after the surgery, but then the pain begins to come back, or it could take a year or two before the pain comes back, but it usually comes back in right the exact same area, and then some, typically from a bit of surgical scarring. So in our estimation, surgery is a very last resort. So as Dr. Pearl, the director who started the program, and Dr. Gossel would tell you, with surgery, don't go there until you come here. So here at the Center for Morton's Neuroma, we absolutely advocate a non-surgical approach to healing Morton's neuroma. And that non-surgical approach is called nerve ablation, which is done through injections. There's no downtime. There's no boots, there's no incisions, there's no stitches, there's no crutches. It's just a non-surgical approach. And it could take 2 to 3 treatments. Most people experience 2 to 3 treatments in order to put the pain down. But again, you walk into the office, 45 minutes later you walk out with your own shoes and socks on, and no crutches, no nothing. A lot of people drive to and from the appointments. If you're close by or rented a car when you got here, you're perfectly safe to drive a car afterwards. And for about 5 to 7 days after you get the treatment, we do ask that you don't do a lot of bouncing around on the balls of the foot. And then you're welcome to use your foot any way that you want to. And in 8 weeks, we'll call you and ask you 4 questions. Is the pain better? Are you more active? Are you wearing more shoes more comfortably? And you're getting back to being at a place where you know that the pain is kind of at a very low volume or in your rearview mirror at all. So for instance, everybody has their own kind of concept or how they want to live their day-to-day life. So if you say, I want to go to 3 spin classes a week, and then on the weekends I want to either ski or go on a long hike with family or friends. And that's what a good week for me would be like. And right now I can't really do much of that at all because of my foot pain. So that's how I'm going to know that I'm kind of back to myself, is when I can go to 2 or 3 spin classes a week, and then on the weekend, push it and enjoy some really extra physical activity. So that's how we roll here. We have a definite preference, and really we only treat people with a non-surgical approach. So I would just advise, do a lot of research, ask a lot of people, and if you'd like to have a copy of the study that says that there's a 35% failure rate for the neurectomy or the nerve removal, I'm happy to send that to you. I hope that helps on whether or not surgery is a good idea. All right, thanks.